is Katie Mitchell, and I'm a registered nurse at Christiana Hospital located in Newark, Delaware. I currently work on a medical floor that currently deals with a little bit of everything as far as the medical healthcare profession is concerned. I'm here representing the American Academy of Nurse Practitioners in hopes to sway you, the House of Representatives, to rule in favor of making the scope of practice for nurse practitioners standard across the country. As it stands today, there are only 11 states that allow nurse practitioners to practice independently without physician involvement. 27 states require nurse practitioners to practice in collaboration with a physician, and 10 states require a physician supervision of nurse practitioners. So as you can see, each state's stance on this topic varies greatly. I'm here today to ask you for your consideration in passing a law that would allow nurse practitioners to work independently of physicians and allow them the autonomy to oversee themselves. In December of this year, I will be graduating from Wilmington University in Delaware with my master's degree focused on family nurse practitioner. It is my hope and dream that nurse practitioners will receive the green light to be able to practice independently without direct supervision of a physician. The goal of my presentation is to adopt a uniform scope of practice laws to reduce variability among states. As it stands now, as I mentioned earlier, the law is preventing professionals from practicing to the full extent of their capabilities, which negatively affects healthcare costs, access, and quality. The professions and the public are ill-served when practice authorities differ dramatically among states. So you can see where the confusion is by not having every state with a set determined amount of laws. The nurse practitioner role has its start in the mid-1960s in response to a nationwide shortage of physicians. Unfortunately, this shortage continues to be a problem today and can only benefit by allowing nurse practitioners the autonomy they so rightly deserve. Currently, nurse practitioners may perform services authorized under the scope of practice provisions of the Nurse Practice Acts of their state. In the mid-1970s, state legislators began to consider allowing nurse practitioners to prescribe drugs. Nurse practitioners have since gradually achieved prescriptive authority in all 50 states. Boards of nursing and nurse practitioners favor laws that would expand nurse practitioner scopes of practice, which would allow nurse practitioners to practice more autonomously or allow them to perform a wider variety of tasks without the supervision of a physician. Opposing groups such as the state boards of medicine would argue that nurse practitioners are not competent to practice more independently or that they are insufficiently educated and trained. I can appreciate the concern of physicians and other healthcare professionals of allowing nurse practitioners to practice independently. According to one physician, Dr. Randolph Gould, he understands that nurse practitioners are critical to the healthcare industry, but their training doesn't qualify them to treat patients without the supervision of a physician. He goes on to say that we have excellent training, but it's not detailed training as a physician would have. While physicians have 7 or more years of postgraduate training, some nurse practitioners have less clinical experience than what's obtained in the first year of a 3-year medical residency. Okay, I agree with that. I agree that nurse practitioners do not have as many hours in a classroom setting as a physician, but they need to take into account the clinical experiences nurses obtain. Nurses are at the bedsides of patients providing hands-on care day in and day out. Nurses are the ones responsible for determining changes in health status and informing physicians. Nurses build relationships with individuals and gain their trust and respect. According to a survey taken by the Veterans Health Administration, satisfaction scores increased by 5% when more nurse practitioners provided care, and only 1.8% when more physicians provided care. Respondents were more satisfied with services provided by nurse practitioners because they paid attention to the patient's educational needs, met those needs, gave them individualized care, and listened actively. More patients reported a preference to see a nurse practitioner than to see a physician assistant or a physician. According to researchers at the American Academy of Nurse Practitioners' 26th Annual Nurse Practitioner Meeting, patient satisfaction was higher among patients treated by a nurse practitioner than those treated by physicians. Researcher and nurse practitioner Susan Lyons stated that this adds to the evidence that nurse practitioners are able to work independently. Patient satisfaction comes from respect and listening, fewer hospitalizations, and fewer prescriptions. This is just more proof nurse practitioners can operate effectively, independently, without supervision by physicians. In terms of careful listening, only 50% of physicians' patients reported that they felt that doctors always listened carefully, compared to the more than 80% of nurse practitioner patients. I mean, the proof is in the satisfaction scores. Although nurse practitioner scopes of practice have steadily broadened over the past 4 decades, the actual practice has experienced both highs and lows. Nurse practitioner scopes of practice still vary widely among the states. The profession and the public are being ill served where practice authorities can be dramatically different between bordering states. So, what is legal and allowed in the state of Delaware may not be the same precedents as what is allowed in Pennsylvania or Maryland. So, you can see where the changing of the state laws state by state is becoming a problem. Hence the call for a universal stance nationwide. Physician preferences and nurse practitioner practices are inextricably intertwined. A 2003 study of rural and urban physicians' perceptions of nurse practitioners found that physicians in both settings perceive that non-physician providers, which would include a nurse practitioner, 1. Possess the necessary skills and knowledge to provide primary care to their patients, 2. Are an asset to the physician's practice, 3. Free the physician's time to handle more critically ill patients, and 4. Increase revenue for the practice because it costs less to employ these people. So this is my plea to you representatives. This time is now to make the change. With the increase in both healthcare costs and patients on the rise, nurse practitioners are ready to answer the call for the help. Won't you allow us to practice without direct supervision by a physician?